Joining us today is Dr. Michelle Little, who has worked closely with patients and families facing end-of-life decisions, helping us understand the challenges that are presented to patients and their families. I'm Ian Bunston. Welcome to Monday Matters. Welcome, Michelle. It's a privilege to have you back again and coming live all the way from Vancouver.
My pleasure. Thank you for asking me back.
Michelle, you have a wealth of experience in the area of voluntary assisted dying, facilitating the passing of over 350 people. How do you personally reconcile compassion for suffering with the value of preserving life?
Well, it's actually easier than what the question would assume. So everyone dies, every single one of us. No one lives forever. We always have a terminal part to our illness, whether it's expected, whether it's unexpected. And so assistance in dying basically just shortens that time frame if you have, by definition, a terminal disease, illness, or disability. So the thing is that we're all going to die. It's just that now we have a choice, and we are very fortunate in Canada and Australia that we have that choice over our body. What I really appreciate with assistance in dying is that, by definition, in Canada, it is intolerable suffering, but it's your definition of intolerable suffering. So, and that's different for everybody, given your life experiences, given your illness, your beliefs, all that kind of stuff. So for me, I like to talk. If you took away my ability to have meaningful conversation and meaningful communication and someone had to wipe my bum, I'm out. To me, that's intolerable suffering. But for others, it's not. Like, they're happy to be turned in bed every 2 hours and to have a Foley catheter or a feeding tube or, movement with their eyes, whatever it is. I had this one lady that the definition of intolerable suffering was that she couldn't go to bingo. No, she had end stage emphysema, right? So she basically could not walk to her car anymore, even on maximum oxygen. She couldn't sit in a bingo hall. And so for her, there was nothing left that gave her joy in life. And so on the day of her choosing, she got all her bingo friends around. They played bingo. She says, "Can you come at 2 o'clock?" So I turned up. They're all in the backyard. They played their bingo. And I said, "So did you win?" She says, "No." And I said, "But you're not really going to need the money where you're going." But it was just like, that's her definition of not enjoying life, not bringing joy, and intolerable suffering. So I appreciate that. And I appreciate the fact that what we choose to do with our bodies is our choice. You can choose to poison your body every weekend if you want, with drugs, alcohol, whatever you want. You can refuse chemotherapy if you want. You can terminate pregnancies. You have control over your body. And that's what these legislations are about. It's basically an extension of that. So with the suffering component of it, so we've talked about the choice, but the suffering component of it is that, who determines what is enough suffering? And I appreciate that, again, respect for individual autonomy. So how much pain is enough? Right? There are people who live with chronic pain, and there's different types of pain. There's like nerve related pain, there's bowel dying pain, there's headache pain from internal hemorrhage, and how short of breath is too short of breath. So, like, for that lady with the emphysema, she was basically bedbound. She couldn't do anything anymore. And so that is a level of suffering. In others, it's more to do with dignity. So there are certain conditions that take away your cognition, your dignity. You can't toilet yourself. You are dependent on other people. Not everyone has family around. Not everyone can pay for private care. You're dependent on the state to provide care. And so surviving is not the same as living, which I think is very important. And I think we can't judge until we've been in their shoes, right? And hopefully we'll never be in their shoes, right? I mean, we will all be at the end of life, but you don't want a brain cancer, and you don't want a lung cancer, you don't want emphysema, or you don't want ALS. You never want to be in their shoes. So you have to respect that they say, this is it. I don't want to do it anymore. And most people, I would say 99.99%, they don't want to die, but they're dying anyway by definition, right? In order to qualify for assistance in dying, you actually have to have a terminal illness. But most people at the end of their life have loved who they wanted to love. They've worked, they've gone on holidays, they've seen the next generation come up in their family, and they describe it as being done, right? There's just nothing left to do. I mean, some people don't get that chance, and that's where life is just unfair. But by the time you get to that, the balancing of wanting to live more versus your suffering is a very easy decision to make.
Mm. So, Michelle, with this whole process of voluntary assisted dying for the person, the families, the loved ones surrounding them, they're a big part of the whole process. So, I'm interested to know that what do you say to families who feel that they're being asked to let go before that they are ready for their loved one to go?
Well, it's lovely that you have that problem sometimes because there are a lot of people who don't have family. Like they've either moved away or they've lived so long. We've got so many people who live into their 90s, or they're estranged from their families, or they're in care. So the fact that families, that can be a good problem to have. First of all, in Canada, it is your wishes. So the legislation overrides that of your power of attorney, which I think is wonderful because I had one situation where this lady had heart failure. She couldn't breathe at all. And her children wanted to wait till she was unconscious and then revoke her ability to do MAID. Fortunately, we don't have that, can't be done anymore. There's called a waiver of final consent, and the patient's wishes override any substitute decision maker at the end of life, which I think is very good. We don't yet have advanced requests. So like I can't say at the age of 49, if this happens to me, I want assistance in dying. You have to qualify at the time. But the main thing with families is, I think, education. Most people, when I go see them, if they have concerns, they always feel a lot better once I leave. There's a lot of misinformation out there. I know that there's a video of someone's, they were told that they're suffocating and their saliva is too much and all that kind of stuff. And that's just not true because you're fast asleep and then your heart stops and you stop breathing. There's no time to produce the saliva for suffocation, right? So I think that education is the most important part. And also, I think that family need to see the suffering that the patient has. So I find that most times people who object to assistance in dying aren't involved in their care. They just think, Mom, just take more pain relief, or Dad, you know what, a nurse can help you go to the toilet. But they don't see the suffering, the extent, the duration, the intensity of the daily suffering that these people go through. And so, again, it's education around that point of, they're requesting this because their suffering is intolerable. Um,
Mm.
yeah, I had one lady who said that, she doesn't, she felt it was against God's will, but she was willing to take the risk of, the suffering was too bad in life and she didn't care what was coming after life. I think it's difficult with religious reasons. Again, I'm not here to change anybody's mind, but I can tell you that the people who are religious cannot wait to meet God. Like they are so excited. Like the priest is in the room, or, they're just saying, this is it. I'm going home to God or Jesus. For the people who aren't religious, the joy on their face about going to see their mum or going to see their dog or whatever. I did have one lady say, she says, will my mother-in-law be in heaven? And I said, do you want it to be? She says, no. I said, then she won't be because this is your heaven, not hers. But it's very interesting, the conversations that happen at the end of life about what's on the other side. And even people who don't have any beliefs about the other side, they just don't want to suffer anymore. So,
Mm.
yeah,
So,
I
so
think education's the biggest thing.
yeah. So in some ways, Michelle, my next question you probably touched on a little bit already, but like, have you ever feared that choosing voluntary assisted dying could feel like a burden on the loved ones rather than a relief?
It seems like that when you sign up for it. So most people want to sign up for the registration purpose like way before the end of their life, right? Because it gives them a sense of control, a sense of happiness that they will always have a choice in what happens to them and their body, especially when things are going to get worse. Because by definition, the day they sign up, that's the best they're ever going to be. It's always going to get worse after that. Um, I point out the really good things about planning things. So you're never alone, right? There's always going to be a nurse and myself there. Your family's not going to get the phone call saying, "Hey, we found mom dead at 3 a.m. in the hospital," where you died alone, you're in a 4-bed room. Who knows what you could have been suffering but couldn't call the nurses or the nurses were busy. So that's a relief. I also think you have the chance to say goodbye. Um, I had this one Italian gentleman. He went home from the hospital surrounded by his very Italian family. Anyway, he had phoned his arch nemesis in Rome that day to basically put to bed a 20-year-old feud because he was dying that day. He knew that. And so they apparently had the best conversation. They were singing, they were reliving their childhood, whatever this feud was. And to me, that's really special that if you die in a car accident or if you die in a hospital bed by yourself, you don't get that chance to say goodbye, whether it's a good thing or saying sorry for previous bad blood.
Mm.
Um, and then the other thing I think is planning. Like when you sign up for a maid, you have to have a funeral home organized. You should have a will. You should look at your life insurance policies. And so I think that's part of good planning for death in life, right? Because so many people just say, "Oh, I didn't get a will," or, "I haven't thought about that," or "I haven't done that." And this gives them a chance to get their stuff together so that one, it's easier for the family, and two, your property and your wishes are honored. Whereas if you don't even think about that stuff, it's not going to happen.
Mm.
Um, so.
Yeah. Now, Michelle, you're really quite a unique person having facilitated over 350 of these processes of voluntary assisted dying. It's like, wow. But I was just thinking for you personally, if you are facing this choice yourself, what would be the hardest part for you to be saying yes?
Well, first of all, I see so much suffering that you don't have to ask me twice. Like I'd sign up now, I'd tattoo it on my chest, whatever you need. Um, and a lot of that goes with the healthcare providers as well, because they've always said, "Okay, you have to sign this, blah, blah, blah." So for me, it would not be a hard decision. It is hard for me now at 49 with two teenage boys to even consider the chance of naming the day that I die. But then I'm not ready to die yet. Like fingers crossed, I won't have that problem to go. For me, I think my perfectionistic tendencies would make it hard because I'd want to make sure that, I mean, I've had a will since I was 16. My dad's been huge on that of planning. Make sure the funeral home's done, make sure my obituary's written, make sure you've got enough photos for the slideshow of my celebration of life, like the practicalities of that. I think I would almost stress about that. Um, I think saying goodbye to people, like literally goodbye, would be hard. Um, However, I think what I would find hard is the effect my death would have on my dad, my sister, my friends, my kids, all that kind of stuff, knowing that on Tuesday at 10 a.m., I'm not going to be here. But I can tell you that when people call me, they're done. They want to go now. They've made that decision. There has never been a person in that 350 people that have regretted it at all. They almost say, "Can you come today?" Which sometimes we can pull it off, but it's a feeling we just don't understand. It's because we're not in their shoes. And the wonderful gratitude that I get is that they are so happy to see me when I walk in the door. Like sometimes these are people I've met just once, and I get the biggest hugs and kisses, and I'm so happy to see you, and yet I'm just about to end their life. But that's what I'm trying to get across is the joy that it is your choice and that your suffering is going to end and that you are at the end of your natural life. This is a natural death, both legally and morally. You are dying of your cancer, you're dying of your heart disease. It's just that you're shortening the time frame and you have control over that.
Mm.
Um, yeah.
Yeah. Now, Michelle, I'm sure that all of the sessions that you facilitate over are all really quite different, but can you describe to all of us what a session looks and sounds like?
Sure. So in Canada, we have three forms that need to be filled out. One is a patient request form that just has to be signed by a witness not in your will. And then you need two doctors or a nurse practitioner to sign off that you qualify, meaning that you're Canadian, over 18, and you have a terminal illness, disease, or disability, and that you're suffering from that. So if I got cancer tomorrow, I wouldn't qualify because I'm not suffering from it unless I have extensive suffering about what is going to happen. Anyway, so once they put their request in, we have a coordination center and then they give it to me. And then I go and meet the person, hopefully with family, because it's always nice if family's supportive. And then I talk to them about, what makes you want to think about MAID, make sure that they medically qualify, of course, that they're competent to make that decision. And then we just go through what it is. So my little speech is that you have the right and opportunity to pick a day, a time, and a place that you wish to leave this earth. And you do that by having the best sleep of your life. It can be in a hospital, in a hospice, in a home, anywhere you like. A nurse will come with me. They will put in an IV. And then I'll give you three medications. They're the same ones we use for surgery, just in bigger doses. The first one is called midazolam, and that's the one that you give pre-surgery. And that's the one that makes you feel like really chill, calm, relaxed, and you just want to close your eyes. So you'll be asleep in 1 minute. The next medication is the propofol. It's a medication that deepens your sleep until you pass naturally in your sleep. And then the last one is a muscle relaxant. The whole thing takes like 5 minutes, but the person is asleep in 1 minute. They often snore or take some big breaths. And it's very sweet because you actually see the moment that they let go. And then they have this just overwhelming, peaceful look about them. And that's most times there's crying, but there's so many smiles of the fact that mom, it's okay, and to be surrounded by love at that time. And the last thing they hear is, I love you, mom, or thank you for my life, dad, or say hi to Johnny, or, pat the dog. And that's what they literally go to sleep hearing and holding hands. Like most times, someone's got a foot, someone's got a hand, someone's, touching their head, their favorite music is playing. It can be anything you want. And again, it's about autonomy. And I joke, you can be wearing your finest clothes, you can be wearing pajamas. I just personally request no nakedness because I don't need to see that. But you can have your pets. I've got lots of stories about, how the cat and the dog, they know, they sniff the medications, they put their head on, their parent right when they're leaving. We had one cat that came, and as soon as she passed, got off and went into the other room. And then when everyone else left the room, the cat came back and sat on her mum. And I've got lots of stories about that. It's just the most beautiful and amazing, peaceful, controlled, desired event. And I'm just so happy and grateful to be able to provide that and to live in a system and a society that values that. And I can't tell you how much joy that brings me every single time. There's not been one that I have thought this is the wrong thing to do. And there's been some pretty grey ones. And you do always worry about the legal ramifications because it is a criminal, it's under the Criminal Code Act. So if I was found negligent, it would be 14 years in prison. So, the stakes are high, but you know what? The joy is just, you can't describe it. It's just, yeah.
Mm. Well, Dr. Michelle Little coming live from Vancouver. Thank you for leading us in an insightful and extraordinary conversation. It's been an
You're
absolute
welcome.
pleasure to have you as our guest at Monday Matters.
Thank you very much.